Have you been diagnosed with uterine cancer? I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical in the beautiful Scottsdale, Arizona. Uterine cancer is a cancer obviously affecting women, but it's not just about cancer of the lining of the uterus. It can actually involve the muscle part of the uterus or even the serosal, which is the layer that surrounds the muscle. So there's a glandular part of the uterus, there's a muscle part of the uterus, and then there's what's called a serosal side inside the body of the uterus. Most cases, cancer of the uterus is going to be hormonal in nature. So here at Brio, everything that we're going to do is evidence-based and precision-based. And that is the mass and miscommunication that's out there about what integrative cancer treatment is about. It's actually evidence-based. So when you look at endometrial or uterine cancer, if it's hormonal, you have to look at hormones. You have to look at not just estradiol, a type of estrogen, you have to look at estrone, you have to look at estriol, you have to look at the estrogen metabolites. You have to look at the male hormones, the metabolites. You have to look at melatonin metabolites. You have to look at progesterone and metabolites. You have to look at cortisol and metabolites. All of these are playing a role, even including neurotransmitters. By the way, certain neurotransmitters can bind to estrogen receptors. So you have to broadly look at what can affect growth and signaling if you're looking at hormones, particularly looking at the glandular type of uterine cancer. But being evidence-based and being precision-based, we also have to recognize that there are other types of uterine cancer as well. Those that are within the muscle part, sarcomas, leiomyosarcomas. These tend to be much more aggressive type of uterine cancers. And so we have to approach our strategy there different, but again, precision-based. And as we've mentioned before, we want to look at the genomics, we want to look at the epigenomics, the proteomics, transcriptomics, metabolomics, and immunomodulomics, allowing us to understand not just the behavior genomically of the tumor, but metabolomically. How is this tumor behaving? And then how is that structuring the tumor microenvironment? So in both the muscle part of the uterine cancer as well as the glandular and serosal, we often use IPT, insulin potentiated low dose chemotherapy. And of course, we also use targeted therapies that allow us to target in on these metabolomic or metabolically dysfunctional pathways. Even in the immune system, we want to work to stimulate the immune system, target the immune system through things like high-dose vitamin C, curcumin and quercetin, which suppress the immune system, something like DCA that actually really helps to target aggressive, fast-growing tumors that are really using this Warburg effect, that is using sugar very inefficiently, yet very high speed to meet the high metabolic demand. Even using things like artesunate and artemisinin that allow us, along with vitamin C, to modulate the immune system within the tumor microenvironment. So when we couple these together and then really stimulate the immune system with things like mistletoe, with hyperthermia, it really allows us to bring a broad strategy, evidence-based, targeted, precision approach to the treatment of a wide spectrum of uterine cancers, whether that be the glandular, the muscle part, or the serosal. We can even use photodynamic therapy to allow us to access up into the uterus to actually use different wavelengths of light, standalone, but also to augment other therapies. So really, the evidence is very clear. The precision is targeted. Here at Brio-Medical, if you have uterine cancer, we not only can use the evidence to guide us, but we can also be very precise using precision-based cancer care to help target the tumor and heal the body. That's our objective for you. There's hope, there's healing. Our job is to teach you how to heal as we serve you in that process. To learn more about a healing strategy for the treatment of uterine and other types of cancers here at Brio-Medical, I encourage you to go over to our website there. I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical. I look forward to meeting and talking to you soon.